everybody, welcome to my whole body approach series. So basically it's about how to take a body part and how to integrate it to the rest of your body. So I've gone over previously the knee, the ankle and foot, and now I'm going to be talking about the hip today. And actually the hip is such a big animal. There's so many things that the hip can help, or if there's something wrong with the hip, it can actually hurt other parts of your body. So I'm actually going to break that down into this first video. I'm only going to talk about the front of the hip, and I'm actually going to talk about the hip flexor and how it relates to your lower back. So the hip flexor is this big, huge muscle attached to the pelvis, and it goes and attaches to literally your leg bone, your femur. And then what happens is, okay, am I close enough now? And it goes and attaches to your lumbar spine, which is your vertebrae here. And see how it's connected here, both into your pelvis here, and it goes into your leg. So what happens is when you are tight, when that muscle is tight, it actually is going to pull your lower back forward, and your lower back actually then tries to stabilize your back by spasms. So oftentimes when somebody has lower back pain, I tend to work on the front of the hip before I even touch the lower back, which is kind of counterintuitive. But if you look at what I just showed you, that this is the front and it attaches to these vertebrae here, then you can see how if it's shortened, then it's going to pull the vertebrae forward, and back here the muscles are going to try to fight back. It's fighting against it and spasming. And this often happens when we sit too much, and it also happens when we do crunches, and instead of using our abdominals, we're actually using our hip flexors to kind of try to lift ourselves up. This can also happen if you're doing a lot of exercises where you're lifting your knee, like those butterfly kicks that you do. So all those things may not be wrong exercises to do, but if you don't balance it out with lengthening them, then they can have a huge impact on your lower back. So if you feel like you're having lower back pain, try to do this assessment. So basically all I want you to do is I want you to try to keep your heel down on the ground and put your hands on your hips and just lunge forward a few times, okay? So when I do this and I'm in the clinic, after a while, look down and see, are your toes turned out or straight? Okay, so are your toes turned out or are they straight? If your toes are turned out, that means that your hip flexors could be tight. So then this is where you're gonna wanna do some soft tissue work, or you're gonna wanna do some dynamic stretches that I'm gonna show you right now. One of them is super simple. You can do it on the ground, but I actually like to do it standing up, where if I'm stretching my right hip flexor right now, I put my feet on something like a staircase or a chair, and I just simply actually try to move my pelvis forward, back and forth, and I feel this lengthening. And if you don't feel the stretch, that's okay. Think about the movement pattern, because a lot of the times that's such a big muscle, it's like taffy. So basically what happens is if you have hard taffy and you try to pull it apart, you're gonna have two blobs, and then the middle part is gonna be teased. And that's what happens, is that this is such a deep, deep muscle that sometimes what happens is instead of stretching this, you end up overarching and you end up overstretching your lower back. And that is really common. So you want to do this and think of it as a movement pattern. So for people that are more muscular, that tend to be men, and I fall in that category where I feel this pretty quickly because I'm so tight there, and also I have the coordination and body awareness. But for half of the population, especially women, sometimes they tend to have more laxity and they're looser, so they tend to compensate with other parts of their body. So think of it as a movement pattern. Over time, I find that patients actually start to feel the stretch much later. They've had to practice this movement pattern for 2 to 3 weeks before they're like, oh wow, I'm starting to feel that stretch deep within. So don't get frustrated if you try this and you don't feel it. Another resource you can have is if you download my PDF where I've been showing the calf stretches, the hip flexor, hamstring stretches, basically 6 fundamental stretches, functional stretches that your body needs to stay aligned. So hope this is helpful. Next time, what I'm gonna do is I'm gonna explain the posterior part of your hips, where it's gonna have impacts on other parts of your body again. So just a quick review. So when you have tight hips, it can really compensate and hurt your lower back. But it can also actually have an impact on your knees and your calves. So over the next few videos, I'm gonna explain other parts of your hips and how it can affect the rest of your body. If you have any questions, please comment below. I would love to help you and dive deeper into how you can have basically a more active lifestyle as we age, as we want to try different sports activities, recreational activities, just to feel good in our bodies and be able to move without all the wear and tear. Thanks so much.